Hi, and welcome to Personal Injury Today, where we discuss the hot topics to help attorneys understand their clients' cases better and arrive at a fair settlement. Today, we're looking at when do you need a medical cost projection versus a life care plan. Stay tuned, and we will be joined by Dr. Brad Poppie to understand a little bit about this confusing topic. We are now with Dr. Brad Poppie, and we are going to just dive into this topic of understanding the difference between a medical cost projection and then a life care plan. Can you just tell us the difference between the two and when we would need to order which one?
Sure. Where do I begin? This is a very highly debatable topic within this realm. And to be honest, there's really no direct, clear answer. Okay? Medical cost projection and life care plan methodology and terminology are it's kind of a gray area. Okay? But let's certainly talk about some of the basic points that differentiate the two, because there are differences, but there's certainly a lot of similarities. So, number one, when you take a medical cost projection, that is basically determining the client's future medical care and costs associated with it. Okay. When I say future medical care, that could be anything from medications to doctor's appointments, physical therapy, occupational therapy, chiropractic, injections, surgeries, anything and everything in regards to their care. And then we put a price tag to it through life expectancy. Some attorneys determine that a medical cost projection should be done when the case has a smaller purse attached to it. Is it under $250,000 of future expenses? Or if the impairments and disabilities or pathological conditions that they developed are not lifelong. So for example, it might be something to where it's a whiplash injury, the patient has maybe some neck muscle strain type stuff, maybe some facet issues where they need to go in and do a couple facet injections, maybe some physical therapy, things like that. Not necessarily something where the patient's going to have that necessarily through life expectancy or require home modifications, okay? That is a medical cost projection in a nutshell. Life care plan, I always kind of refer to them as the life care plan is kind of the big brother of the medical cost projection, okay? Similar methodology, but a little bit more robust. I mean, actually quite a bit more robust. Almost more like a thesis, okay? Still determining the future medical care and the cost associated with it, but now we're talking catastrophic injury. We're talking traumatic brain injury, spinal cord injury, amputations, burns, things like that. Things where, the client most likely will need lifelong care, whether that's nursing home care or in-home nursing, things like that, where it's going to be a lifelong of illness, basically.
So you're looking at that bigger picture over the course of the entire life for specifically that care plan.
Yes. And those are kind of the two main differences. The methodology, however, is basically identical.
So tell us a little bit about your personal methodology. How do you handle these reports that might be different than other people?
So the way I approach these cases is both of them are looked at the same way. Again, it's not my job or scope to determine, how much money is this one worth? How much money is that worth? My job as an expert is to determine their future care and the cost associated with it. So both of them are treated equally, okay, as far as I'm concerned, okay? And my methodology is I get the medical records from the attorney, and I review them, of course, and I'll do a medical record summary, okay? And then I actually go evaluate the patient. I will have them either come into my office and I'll do a orthopedic exam, cognitive, neuromuscular, etc., to determine what's going on with the patient. And then I will then get in contact with their treating practitioners. This is so, so important, okay? I want to know the up-to-date information and recommendations from each and every practitioner, orthopedic surgery, neurology, chiropractic, whatever. I want to know what they think, because that's all going to go into my medical cost projection or life care plan, okay? I'm not an orthopedic surgeon. I can't opine on they're going to need a L3, L4 fusion. I can't do that, but I want to know. So a lot of collaboration goes into it. And then I cost everything out. Okay, different databases, making calls, around the community to different companies that do whatever treatment to get an idea of what this is going to cost. And then basically putting it all together and devising a report. That's for medical cost projection.
Got it.
Life care plan, very, very similar, but again, we talked about life care plans being a little more catastrophic in nature. So these people typically are going to need home care type, care. Yes. So I'm actually going to their home and doing a home assessment as well. So example, maybe amputation. So they're in a wheelchair. So I'm going to go to their house. Hey, do we need to, widen hallways? Wheelchair accessible bathtub? Do we need to make alterations in the house? Do they need a ramp? Stuff like that. Talking with the family, because they're going to be an integral part in the care of that client, or maybe it's their mother or whatever. So it's a little bit higher tier of evaluation with a life care plan.
And those modifications can be really expensive. The family has to be able to plan for that.
Very, very expensive. And again, you think about extrapolating these out through life expectancy. You think about a 30-year-old woman that's had a catastrophic something happen to her, and she needs home care through life. Maybe her life expectancy is 85 years of age, example. What does that picture look like? Maybe she needs childcare, maybe nursing, all of that. So they could, it's certainly a higher tier report for sure.
That's critical. Thank you for that information. If you're watching, whether you are a personal injury attorney, if you're a client in a personal injury case, we want you to like, share, and subscribe. Give a thumbs up to this video if it's been valuable for you. Share with another person that could use this information, and then subscribe to this channel. Click the bell notification so that you can be updated on every video that's put out, so you don't miss any other content that and valuable information that we can get from Dr. Brad Poppie. So I do want to ask one more question on this. You talked a little bit about methodology, and I can kind of maybe hear and see attorneys right now saying these reports are important. We can do this in-house. Tell me what your thoughts on that, in-house versus having an expert conduct these types of reports.
In my experience, I've had numerous attorneys call me, and it's this kind of the same story. Hey, we've taken a stab at producing a cost projection for the insurance company, and they always come back. They don't believe us. They don't think it's, they think it's an overstretch, whatever.
The insurance company doesn't believe them.
Yes, yes. And so then it's like we're back to square one. We can't get to the finish line. So how can you help? And my answer is always the same, basically. It's like, thank you for calling, you're at the right place, but there's a reason why there are certifications to become a certified life care planner.
And you're certified.
And I'm certified. There's a reason why, okay? There's certain methodology that we're trained to do to work on these cases and get them to the finish line, okay? And a lot of times when attorneys try to do it in-house on their own, they're missing key points because again, what they don't know can and will hurt them because they're not thinking like a doctor, right? So there's been numerous times when I've taken the baton from an attorney and said, okay, yes, let's retain me. Let's get a life care plan or a medical cost projection done. And I've uncovered so many more things by, again, my knowledge, my expertise, education, and experience for 20 years, I know, I've worked in the trenches. I've treated these patients. I know what they're going through. I know what they need. And I'm able to develop a solid, valid life care plan because I know what questions to ask and I know how to evaluate and or treat a patient. So I know what their needs are.
That's wonderful. If you are a personal injury attorney watching right now, or even a client that is in a personal injury case, feel free to reach out to Dr. Poppie with any questions that you have. Like and subscribe to our channel. Hit the notification of the bell so that you can be updated every time we put content out there. And again, hopefully this was helpful.